Today we will see about hormones and health. Hormones almost reason for all the diseases. Hormones are doing everything. It is controlling all our lifestyle diseases, and we will see about that and the hidden power of non-aerobic, non-weight bearing exercises which are controlling hormone and facilitating hormone and activating hormones and helping our health and solving many diseases. Today we will see about that. I am the one teaching non-aerobics, non-weight bearing exercises worldwide through online sessions, and whoever needs these exercises, they can contact me every day morning 6 o'clock up to night 10 o'clock, which is 16 hours a day. I am working on it and I am teaching exercises, and myself with a team of physiotherapists, male and female physiotherapists, I am teaching non-aerobics, non-weight bearing exercises to reduce lots of symptoms and to make you come out of so many diseases, particularly lifestyle diseases like diabetes, hypertension, neck pain, back pain, knee pain, arthritis, spondylitis, and weight management, obesity, pelvic floor strengthening, urinary incontinence, bladder and bowel incontinence, and varicose vein, and so much like this. Okay, today we will see about that. Even frozen shoulder, tennis elbow, golfer's elbow, all these we would solve through non-aerobics, non-weight bearing exercises, which is very harmless, which is very helpful. Today we will see how it impacts on the hormone, how it treats so many diseases in the world. Okay, first we will see what are the hormones. Hormones are chemical messengers. It's a messenger to conduct many things produced by glands in our endocrine system. Okay, our endocrine system is producing hormones, which is a chemical messenger. Okay, they travel through the blood to organs and tissues, regulating almost everything. It regulates everything. So, first we have to see growth and repair. It is regulating our growth and repair. We are growing, okay, that one, and repair of our cells and repair of our many things in our body. Okay, for example, growth hormone, which is pituitary growth hormone, and thyroid hormone. These two are example for growth and repair. Okay, and the second one comes metabolism and weight. Our metabolism, which is like we are eating, that is because of the metabolism it goes to our cells. Our metabolism, also our weight management, this controlled by hormones. In this, the number one hormone is insulin. Insulin controls our metabolism, also our weight. If insulin is not working proper or insulin resistance, then we get diabetes, which is a very big disease in the world, particularly in India. So this is by hormone. Many people you may not know, now you come to know it's through hormone, insulin. And leptin is the hormone to weight our control and to facilitate metabolism, which is the highest reason for weight control. This is the boss for weight control. And ghrelin is the hormone for hungry. If you are stressed, it will make you hungry again and again and again. So these three controls your metabolism and weight. Okay, then the third point comes mood and emotions. Our mood, good mood or bad mood, and good emotions or bad emotions, all these controlled by happy hormones. Example like serotonin, dopamine, and cortisol. Cortisol is a stress hormone which can secrete more if you are stressed, which can be regulate if you are happy and with love. So fourth one, sleep. Sleep is facilitated by hormone called melatonin. Melatonin secretion is good, you will get sleep, otherwise you will never get sleep. Okay, sleep disturbance will come, insomnia will come. So we have to facilitate melatonin through our actions. Okay, then comes reproduction and sex drive. Reproduction means giving birth to the child, male or female child. And sex drive, you male attracts towards the female, female attracts towards the male. All this happens through estrogen and testosterone. Testosterone is male hormone, estrogen is female hormone. And also the next comes blood pressure and fluid balance. Example, vasopressin hormone and aldosterone hormone and vasopressin hormone are reasons to control your blood pressure. If it is not controlled or not regulated, if it is not activated properly, then BP rises. Okay, it is reason for your hypertension. Also your fluid balance, whichever fluid inside the body, for that aldosterone hormone and vasopressin hormone are the main reason. Okay, now we have seen about the hormones. Now we are going to see about what happens when hormones are imbalanced. We will see, you will be shocked by this. If hormonal imbalance have happened, it can cause weight gain. You can go to any weight. Thyroid hormone can create 100 kilo, 120 kilo. Hypogonadism can create up to 250 kilo. Okay, so it can create weight gain or weight loss. Hyperthyroidism can lose your weight. Okay, for example, insulin resistance can lose your weight. Sometimes it can gain your weight. Thyroid issues. So these hormones are one of the example for weight gain or weight loss. And the second one, high blood pressure, hypertension, BP, it comes through hormone. Cortisol is the stress hormone which can increase. If cortisol is increased, stress is increased, it can give you hypertension, high blood pressure. And aldosterone issues also can, this is only regulating our pressure, blood pressure. Aldosterone hormone is the reason for high blood pressure if there is issue, if there is imbalance. And the third point is fatigue, anxiety, depression. All the three comes through hormonal imbalance. Which hormone reason for fatigue, which hormone reason for anxiety, which hormone reason for depression? I will tell you. Serotonin hormone is reason, because serotonin is a laughing hormone. If you don't at all laugh, then you will get a depression. Okay, straight opposite. Dopamine deficiency, this dopamine and serotonin can cause fatigue, which is you feel tired, and anxiety, which you are always in fear of future, and depression, which you are mood upset always. Okay, it can create. And next comes poor sleep. Low melatonin can cause poor sleep, insomnia, you cannot sleep well. That can cause many diseases after. So melatonin is the reason for sleep. If low melatonin, you will not get sleep. And PCOS, PCOD, infertility, not giving birth to child. PCOS, PCOD, irregular periods, and a big problem in the female uterus, all these. And low libido, no sex thirst, not able to, impotence, or erectile dysfunction, not able to, male can satisfy a female, female and not able to satisfy a male, and no interest in the sex. These can cause infertility. And all these controlled by the hormones called testosterone and estrogen imbalance. Testosterone is main reason for the male, estrogen is the main reason for female. So these imbalance, testosterone estrogen imbalance in male also, this becomes imbalance. This imbalance can cause, definitely can cause infertility, also low libido. Okay, and next, imbalance may result from what we will see in this video. Imbalance of the hormones can be result from the following. You watch carefully. chronic stress, always in stress, not rare stress, always in stress. Life is stress, no day without stress, no hour without stress, no minutes without stress. That chronic stress can cause all these imbalances. That is the main topmost reason. Poor sleep can cause insomnia, not sleeping well. That can cause the second main reason to cause hormonal imbalance. Lack of movement, sedentary lifestyle, just lying down, no movements at all, that can cause hormonal imbalance. Nutrient deficiency, not eating plenty of fruits and vegetables, just eating idli, dosa, puri, chapati, rice, all these only eating, not adding fresh fruits and vegetables, raw fruits and vegetables which is uncooked. You have to have it more and more and more. With a day without fruits and vegetables, a day without nutrition, you have to know this. And aging or disease, age related also. But if you are very happy, very enthusiastic, very loving, very libido, if you have, you will not feel. Aging cannot affect these hormones. That is the least reason. Okay, by aging also can cause, or diseases can cause. Diseases comes because of the hormone, because of the disease again hormone get imbalanced, so two-way it affects. So this all can cause hormonal imbalance. Now, how to restore balance naturally? How to restore balance naturally? We will see hormonal balance to avoid all the lifestyle diseases. The biggest disease in India, diabetes, hypertension, insomnia, and pain, neck pain, back pain, stress induced pain, and knee pain, osteoarthritis, spondylitis, autoimmune disease. All these can be controlled by hormonal and psychiatry problems as well. Okay, it can be how to balance naturally. We will see. Hormones don't respond only to medications. Okay, you are thinking hormones can respond only to the medications. They respond to lifestyle signals, which is most important. Lifestyle changes, lifestyle signals. You want to know what is lifestyle signals? I will tell you. Especially from gentle mindful movements, non aerobics, non weight bearing exercises, which I am teaching from so many years around the world. I am teaching online from morning 6 a.m. up to night 10 p.m. 16 hours a day globally from 30 countries. At least 100 patients are coming to my online sessions, which is very effective, which can control hundreds of diseases, make the world disease free. And I am teaching it with a team of male and female physiotherapists. You can know this, learn this from me, one-to-one sessions. Okay, and gentle mindful movements can control, can facilitate, can balance your hormone. It can relieve your hormonal imbalance. And that's where non-weight bearing, non-aerobics exercises come into this. Okay, how gentle exercises activate hormones biologically. Biology of this I want to speak now. Cortisol, stress hormone, which is the main reason for the disease nowadays. Everyone is with cortisol. No one is without cortisol. Everybody with stress. No one with very happy or very loving, very much with libido, very much with enjoying fun and vibe. No, almost it's becoming reducing day by day. I cannot tell 0% with happiness, but it's like that. Out of 195 are in stress. Okay, even though they have tech, they have nice world, they have home, they have air condition, they have car, everything, rocket, everything they have, but they are in the same position, stress. So cortisol, stress hormone. So stress hormone imbalance can, stress hormone elevation, stress hormone cortisol elevation can lead to weight gain, obesity, hypogonadism, hypothyroidism, obesity, very big you will become. and also it can make insulin resistance. Both are very big diseases. One side obesity, which can cause many diseases. One side insulin resistance, which is diabetes. Okay, sugar patients, you will become sugar patient, type 1 or type 2. And the in cortisol, the B is gentle exercises effect. Gentle exercises effect can really activate these hormones. Gentle exercises can activate your cortisol, can reduce your cortisol level, and can control your weight, can control insulin resistance. It can become insulin sensitivity. It can really make you disease free. Okay, those exercises, gentle exercises, are called non-aerobics, non-weight bearing gentle exercises, which I am teaching online always. And gentle exercises affects, for example, deep breathing, isometric exercises can reduce cortisol by activating the parasympathetic nervous system. Calming down the parasympathetic nervous system, very useful in hypertension, very useful in sugar patients, very useful in controlling weight, very useful to control your cortisol, stress hormones. So deep breathing exercise and exercises from the head to toes, all muscles, gently teaching exercises, can isometric exercises can control cortisol by activating the parasympathetic nervous system. And the second point, how hormonals can be activated through non-aerobics, non-weight bearing exercises, I will tell you. Insulin and glucose regulation. Insulin and glucose regulation imbalance caused too much insulin can cause weight gain, can cause also diabetes. Both can happen. Okay. How to control it through non-aerobics, non-weight bearing, I will tell you. Gentle movements improves insulin sensitivity. Non-aerobics, non-weight bearing exercises, which I am teaching from past 28 years in my experience. I traveled around 30 countries. Now also I see patients globally, so many patients coming from morning 6 a.m. up to night 10 p.m. I am teaching with team of physiotherapists. Those exercises I am teaching for 15 days, and you take home exercise for 2 hours from head to toes, including breathing exercise, including facial exercise, including exercises for everything that can really increase insulin sensitivity. In this way, you that can really control your diabetes, and without over exercises. Over exercises, aerobics, weight bearing, doing too much exercises, not at all necessary to control. That can increase your cortisol, and that can give you more diabetes also sometimes. But my exercises always controls, no side effect. Even 95 years old can do, even heart patients can do, anyone can do. Okay, fit for everyone. And the third point is serotonin and dopamine. It is helpful. Serotonin and dopamine are helpful mood and activation. Okay, imbalance, low levels of serotonin and dopamine can cause anxiety, depression, and emotional eating, stress eating, always eating because of the stress. So this can be controlled by low levels, or this can be controlled by non-aerobics, non-weight bearing exercises. How I will tell you. Slow and mindful movements, which I am teaching in my sessions. Slow and mindful movements can boost neurotransmitters. It can boost neurotransmitters via brain derived neurotrophic factor release. I will tell you again. It's called BDNF. Note the point, BDNF. Brain derived neurotrophic factor. Brain derived neurotrophic factor. That is BDNF. Okay. BDNF can release, it can BDNF release can boost neurotransmitters. Okay, and that can control your anxiety, depression, and emotional eatings, that can facilitate your serotonin and dopamine, that can facilitate your mood and motivation. Okay, so aerobics exercises, non-aerobics exercises, non-weight bearing exercises which I am teaching in my session, that can help you to make you understand what is what and to be healthy through so many biological medical reasons. Okay, then comes fourth one, growth hormone. Example, burning and repair. Growth hormone is the reason for burning our calories, burning okay, cells, burning the energy, and also for repairing the inflammation, repairing the total body to regenerate. Okay, so this is boosted growth hormone burning and repair, boosted during sleep and low intensity isometric exercise and low intensity isometric muscle activation. That's what I am teaching. Low intensity muscle activation I am teaching in my sessions, non aerobics, non weight bearing exercises. Through that, I am solving hundreds of diseases naturally. Okay, you please remember this. You can join anytime and you can overcome all these. And also, the other point, the B point in the fourth point, bed, floor, or chair exercise. Bed exercise, floor exercise, or chair exercises stimulate these growth hormones for burning and repair without joint stress. Aerobics, weight bearing, and aerobics exercises are having joint stress and also aerobics to exertion to your heart. That I will never give this. Okay, and the fifth one, thyroid hormones. Thyroid hormone support for the metabolism and energy. Our movements, our non-aerobics, non-weight bearing exercises encourage better blood flow and lymphatic drainage. Here is lymphatic drainage, here is lymphatic. That can be encouraged by our exercise. Also, my exercises are improving the blood flow, which I am teaching online worldwide. Many countries patients are coming. Okay, even prevention they are coming. Even to be healthy they are coming. So, in this way, movements can encourage better blood flow, increase the blood circulation. Also, it can improve lymphatic drainage and supporting our thyroid system, improving blood flow, improving lymphatic drainage through non-aerobics, non-weight bearing exercises can support thyroid function. Okay, and the final sixth one you have to know, melatonin. Melatonin is the reason for sleep. You would have had a lot of sleepless nights. I am creating sleep. I am treating insomnia patients through exercises. Physiotherapy is a fantastic profession which comes mainstream medicine. It comes under English medicine, mainstream medicine, but without any medicine, without drugs, without no side effects, treating patients only through exercise, do's and don'ts, and lifestyle modification, and teaching about the diet and about the mental health. Okay, about the positive attitude, about the love, about the lifestyle. Okay, happy lifestyle. Through this, I am giving cure to many in the world, spreading positiveness, spreading love, spreading disease-free world. So I want to guarantee you this. Okay, my non-aerobics, non-weight bearing exercises which I am teaching online, that can gentle evening routines, particularly evening routines with breath work, okay, breathing exercises, reduce stress and help regulate circadian rhythm. Circadian rhythm is the sleep rhythm. Okay, circadian rhythm, sleep rhythm, which is coming in the night. You are changing it circadian rhythm. Nighttime working and daytime. Or you are from India to you are going and working in UK, going and working in America, going and working in Australia. As soon as you go there, you are in a different timing. You are in the some part of the earth. That is called circadian rhythm. that can be controlled by my non-aerobics, non-weight bearing exercises, particularly if I teach you in the evening, that too through breathing exercises that can boost melatonin production and that can make you to sleep. Whoever gone out of the country, whoever not getting sleep, whoever working night times, they can really take my exercises and come out of sleepless nights. Melatonin can be increased by my exercises. That's why I say 100 diseases can be controlled by doing my exercises. And finally, I want to give you some tips why non-aerobics, non-weight bearing exercise movement works. Why not aerobics and weight bearing movements doesn't work, I want to tell you. Non-aerobics, non-weight bearing exercises, movements activate slow twitch muscle fibers. Note the point, slow twitch muscle fibers it activates, which are linked to metabolic and hormonal health. Slow twitch muscle fibers are linked with metabolic and hormonal health. So in this way, because we are doing very gentle, doing non-aerobics and non-weight bearing exercises, you know what is non-weight bearing, non-aerobics exercise? Aerobics means cardiac exercise, which not involve your cardiac exercise, which is not, I will tell you aerobics, then I will tell you non-aerobics. Aerobics are walking, running, jogging, swimming, cycling. These all I am not teaching. Non-aerobics, lying, supine lying, right side lying, left side lying, prone lying, sitting. Exercises with sitting and lying from head to toes, exercises, gentle exercises, 7 repetitions I am teaching. That is non-aerobics, non-weight bearing exercises. That too I am teaching including with breathing exercises. You know, breathing exercises can do wonder, can regulate everything, can calm down, can make you sleep, can make you stress free, anxiety free, disease free. That I am teaching. So you have to note down, this is called non-aerobics. And weight bearing. Weight bearing means bearing the weight on your leg. Again, standing, walking, running, jogging, all these you are bearing weight. I am teaching non-weight bearing. You will never bear your weight. You are lying and doing or sitting and doing, not bearing the weight on the leg, which reduces the stress on the leg. Also, it can be very much positive for many diseases. So, my exercises are activate slow twitch muscle fibers which are linked to metabolic and hormonal health. And the next comes, it avoids cortisol spikes. You know, cortisol suddenly spikes, which is seen in intense workouts. In intense workout like aerobics and weight bearing and intense workouts can spike your cortisol. That one can be avoided by non-aerobics and non-weight bearing exercise. So already I told you I am teaching non-weight bearing, non-aerobics exercise online worldwide from a team of physiotherapists. I keep, and from morning 6 a.m. Indian time up to night 10 p.m. Indian time, which is 16 hours a day. Anyone can come anytime, and I am teaching for 15 days, which can really help to avoid cortisol spikes which seen in intense workouts. Mine never give cortisol spikes. And also the third one, reduces joint stress while still stimulating nerve hormone muscle connections. You understand? Aerobics and weight bearing exercises give joint stress, but what I am teaching non-aerobics, non-weight bearing exercises that does not give joint stress, but stimulating exactly what is needed, stimulating nerve hormone muscle connections. Nerves, hormones and muscles. Hormones are the messenger between nerve and the muscles. Because what is diabetes? Nerve muscles and the middle hormones. Insulin is a hormone. It is not taking the glucose into the cells. That is insulin resistance. That's why diabetes comes. So it is creating that connections, okay. And the final, improves vagal tone. That means rest digest system. Rest to the digest system, that is called vagal tone. It is improved by that non-aerobics, non-weight bearing exercises, promoting full body hormonal balance, so you can live disease free life. And this is the only solution to come out of all the diseases. And the next, I want to tell you examples of hormone activating gentle exercises. I wanted to tell you, give you some examples of hormone activating gentle exercises. Okay. First, I will tell you type, example, and benefit. Okay. Breathing exercise is a type of exercises. For example, diaphragmatic breathing, which is like up to the abdomen, not upper costal, not lower costal, up to the abdomen. And the benefit of this is it reduces cortisol, it boosts vagal tone. Okay, vagal tone means rest digest system. Our digestive system rests, that can be boosted by non-aerobics, non-weight bearing exercise, which I am teaching online all my life. Okay, my young age itself, I found this is very helpful to the people. That's why my practice is going out of the country, out of the state, out of the continent, going globally everywhere. Before I was traveling 30 countries, now I am receiving patients in my home from 30 countries or more every day by online sessions. Okay. So breathing exercises, type of the exercises are breathing, particularly diaphragmatic breathing can reduce cortisol, boost vagal tone. And the second one, isometric exercises, which this is an isometric exercise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This I am teaching many patients, all the isometric exercises to the total body. For example, wall pulls, chair bracing. These exercises can benefit by it stimulates growth hormone and testosterone. Okay. And the third example, stretching exercises, like type of the exercises stretching, and example are seated yoga or tai chi. It can improve serotonin and flexibility. Okay, it can improve flexibility as well as serotonin hormone, happy hormone, by stretching. For example is seated yoga or tai chi. And the next one, floor exercises, glute bridges, bridging exercise for gluteal, and leg slides. All these can help improve insulin sensitivity. Insulin resistance is reason for the diabetes, insulin sensitivity to overcome the diabetes. So these are the examples of hormone activating gentle exercises, which is non-aerobic, non-weight bearing exercises, which I am teaching online. Okay. Morning 6 a.m. Indian time up to night 10 p.m., which is 16 hours a day. So next one is conclusion for the total video. Hormones are not just chemistry. Okay, you don't think hormones are just a chemistry. They are biology. They are biology in motion. All our motion, all our exercises, all our moving, it is the biology of the motion. All my exercises, non-aerobics, non-weight bearing exercises, which I am teaching, that can facilitate hormones. Okay, it is not just a chemistry. When we move in the right way, you have to note, in the right way, not every day running, walking 10 kilometers, 20 kilometers, stressing yourself. No, in a right way. That right way I will teach you. Even gently, I will teach you how to be gently, how to do gently exercises. We send signals. We send signals that, so hormones can send signals that, we send signals that through our non-aerobics, non-weight bearing exercises, it can calm stress. Okay, it can relieve your stress. It can activate healing. Healing happens in your body. You can overcome all the diseases. It can boost mood. It can boost mood. You are in mood upset, you will become, your mood becomes like very positive, you will get motivated, you will travel, you will feel love, you will feel libido, okay, everything you will feel, you will be very active. That can be facilitated through non weight bearing, non aerobics, gentle exercises which I am teaching. So then comes burn fat naturally. These exercises burn the fat very naturally. You are burning the fat by too much exercises. No, very gentle exercises can burn fat naturally without any side effects, with solving all your diseases, particularly lifestyle diseases, particularly diabetes, hypertension, obesity, neck pain, back pain, knee pain, pelvic floor strengthening, all these will happen. So, non weight bearing, non aerobics exercises are safe. You have to notice safe and sustainable. Sustainable, you can do it always without any hesitation. Sustainable, consistent, and deeply powerful. 3 points note down. What I am teaching non aerobics, non weight bearing exercises to reversal many diseases, including diabetes, including hypertension, including obesity, including every neck pain, back pain, knee pain, arthritis, spondylitis, varicose vein, and so many diseases I am solving through this. I am taking online sessions worldwide. Whoever are there, they can come from morning 6 a.m. up to night 10 p.m. If you want this class, you can call me anytime. And this is safe, this is sustainable, this is deeply powerful, especially for the people with hypertension, obesity, or chronic fatigue. Okay, so I am closing this video with this. Now I wanted to tell, if you want these exercises, I am teaching for 15 days, every day 45 minutes. You can come in your convenient time from morning 6 a.m. up to night 10 p.m. Indian time. Wherever you are, you are in the world, I am available online 16 hours a day with a team of male and female physiotherapists. And with the team, I am taking one-to-one sessions. Somebody wants group sessions, I am taking that even, and I am solving all your diseases. This is the best yoga in the world, this is the best treatment in the world, this is the best physiotherapy in the world. This I am doing, treating hundreds of diseases. You don't even no need to consultation with me. Any disease you can enter into that program. Any disease, frozen shoulder, enter into that program. Cervical spondylitis, enter. Disc bulge, enter. Disc protrusion, enter. Disc prolapse, enter. Brachial neuralgia, enter. Facial palsy, enter. You want skin tone, enter. Vertigo or tinnitus sound or palpitation or chest pain or current passing in the hand or numbness, or you want reduce the belly, you want costochondritis, you want relief from lumbosacral strain, lumbar spondylitis, lumbar spondylosis, disc bulge, disc protrusion, disc prolapse, sciatica, or osteoarthritis knee, OA ankle, OA hip, or varicose vein, or plantar fasciitis, tennis elbow, golfer's elbow, carpal tunnel syndrome, diabetes mellitus, or sugar patients, hypertension, obesity, hormonal imbalance, PCOD, PCOS, irregular periods, pre-pregnancy exercise, post-pregnancy exercise, whatever you want, enter into this program. This is the best yoga, this is the best program. This program can solve, really it can create a change in the world can become peaceful, world can become heaven. All the 365 days in a year, world can live without diseases. And I want to confirm this, I am dedicated my life for this. And you can call me for consultation and follow me for health tips. Physiotherapists call me for nice opportunities. And thank you so much. This is Prakash Physiotherapist.